young? When you say elderly, what age are we looking at?
Yes. Incidence of breast cancer, we see breast cancer after the fourth decade of life. That's after 14. Earlier, we are seeing younger people with breast cancer. We have seen 18-year-old girl with age till about 60 before the increase stops. The higher the likelihood of having breast cancer. Usually, after the when we see lump in the breast of a young lady, for example, not cancerous, but we still need to do further investigations. But if we see until proven otherwise,
Wow.
so even though we do investigation, but we should have it.
So, I mean, through to you now, I understand your talk here. We'll just keep trying. Please be patient with us. Cooperation so far. Dr. Habib, misconceptions and half-truths of common myths about breast cancer that you've encountered, and how do they obstruct early detection?
Now, the first thing is denial. And the reason for denial is cancer is a death sentence, which it's not.
Okay.
For cancer and treated early, it could be cured. So more of the myth is that only spiritually. While science has no way of persistently and consistently proving that if it is tackled early, another myth is that is spiritual and requires spiritual. You cut part of the breast, yeah, the person is going to die. That's also that have surgery and other forms of therapy, chemotherapy also scare a lot of people because of what they want is they are not always reality. Even though they mimic what they call, most of us would have known a celebrity called Angelina Jolie. She's been around for for more than 10 years since then, and breast cancer are usually propagated. It's correct. If breast cancer, if a patient with breast cancer presents early, there is
as we dig deeper, it's getting scarier. No, let me just like the body, because in a manner, it's a trust from Allah, and we will render account for how we use our early detection. You mentioned it a few times, and that's a crucial thing. Screening that is done, this investigation, and all of that, practical steps that women can start to take today.
So, examination, we have what we call breast self-examination, where a woman will plot. When standing, she will examine the breast to see if they are almost than the other. And that you would have seen over time that's like that. Most of the time, the person, if the is not much, you can turn your head so that you see if there will be difference, there will be what we call progress. If there is none, then you can lie down on the couch, or while standing, use what we call palpation. You palpate, with imaginary division to the inner outer, the inner outer upper and inner outer lower, right on the left breast. Then you go to the armpits, we call it axilla. You also touch the same using the left hand on the right breast. If there are no skin ulceration, there's no wound in the screen, then you can press the nipple. Then it's a red flag. If you see a nipple, or it necessarily means it is cancerous, it just means you need to investigate for usually 10 days after the first day of your menstruation. That is, menses would have stopped, but you keep counting till 10 days. Then you do this examination this month. However, because you are not trained, you are not using trainings in 3 years, you can also see a matron or your physician to do what, or the matron or the nurse will repeat this test on you, because
to what they're feeling.
So this is clinical breast. You can also do what we call breast ultrasound scan. See if they are lump. What you cannot see with your hand, the image, the ultrasound scan may catch it earlier. And if you are older than 40 years of age, or mammogram. Mammogram is using X-ray to look into anything that would need to investigate further. Most often than not, a biopsy. That's take a sample from the lump or from the wound, and ordinary lump. We call it ordinary lump when we say it is benign, cause any problem. But when it is malignant, we say, and usually a stitch in time saves 9. If you catch it employed and you completely cure the person of that cancer.
So, I mean, are we still together?
Assalamu alaikum warahmatullahi wabarakatuh. Can you hear me?
Assalamu warahmatullahi wabarakatuh. I'm so sorry that you are an expert, you're a public health expert, you are closer to the grassroots. Access to health care is not equal. For women, can they take to safeguard their health? And how can community structures, including can this support invest breast cancer awareness? And in addition to that, throwing some figures to help us understand better, how people. Dr. Amina.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you very much for that question. Yes, breast very knowing the fact that people have very poor carved areas, the hard-to-reach areas of Lagos State. As much as possible, you see Lagos in the light, an urban area, but you have those areas on the river Rhine. You have places that people actually live. They don't have access to those in urban areas have, and it's quite difficult to reach them. Seeking health care for as public health physicians is to go to such talk with the community structures and then try to gather on breast cancer, give them sensitize them on breast cancer, and then of course in such areas you would bear with me that something, I mean, maybe a school or so such as or to the religious homes in that area, churches also, and as women and their families on diseases such as breast, and of course the mosques in those areas can actually in such area places, the khutbahs at the mosque to sensitize from the local government or within Islamic organizations to come and organize help detect. So first of all, do self breast examination. So link them to care, perhaps if there's any form of complaints from any woman or so, and the community as a whole, to make sure that the woman in question, in medical, it has a lot, I mean, around it. It has emotional effects. It actually affects the community also. So everybody within the community is affected when one woman
Interesting. Dr. Amina, so stay with you. A mammogram means that I get that right, and then under the age of 40, you should do all of that. Realistically speaking, sis, in the look that you've served in the past, how realistic is it? Can they afford a mammogram? Primary health centers, primary health care centers, are they equipped? If, for example, you do this self-examinations and you find such a person, knowing their economic status.
Thank you very much. So closest to the grassroots are primary health care centers. And primary care is not, mammography is not part of primary care. Is first of all, we go in steps of sensitizing these women, and then examination. If they're not able to do it by themselves after being taught, we actually do a clinical breast examination for them. And then if we find any lump or anything, we can carry out this mammograph. But then we do not, we don't usually an X-ray based examination. We don't want to expose them to what they were surgeon, and then from there they would now tell them the other things that they need to do. Some other times with a van, the X-ray van that they would use to carry out this, people are not able to go to the hospitals and do not even have the funds to do it. So coming up 17th of this month in Ifelo, an NGO called the Emonja, so they're coming to do that at the community. However, this was indicated, this person found out that this is her age, this is what we have seen, we've done a mammograph. Very much.
Thank you so much, Dr. I mean, I'm going to come back to you in a minute, but let me come to in Luth. So I am sure you're exposed to hundreds, if not thousands. I hope that you have met classes of people, those that can afford and those that cannot. To you, what happened? Just talk us through the process. So you break the news, oh, it's cancerous. So what goes on after that?
Well, to break the news, it's usually the consultant that breaks the news, because usually you don't break the news with the patient alone being a guardian. So you break it softly, and as you are breaking, if you see that it's overwhelming, you don't completely break it. So you first of all, you hit the point, you must let the patient know first that there is treatment, had it, and it is being cured, and everybody you are saying you know, and nobody will know that you are having cancer. If you have cancer, then it's possible. And apart from the fact that most patients are disappointed, some think that it's an affliction from enemy, or that scared because they think there is no solution. Then
see that, oh my God, this is death sentence when we are going to have to cough out millions.
The reason why most people don't do screening is what you know that
my mind, that's me.
So it will not disturb them until they know. But some don't even have the much no money for treatment. So there are a lot of barriers, on more and more people going for screening.
Okay, I'm going to come back to you in a minute, go back to lifestyle. And I would like us to spend a bit more time on the lifestyle. But let me quickly come to the audience to, chip in. Dr. Amina, very quickly, let me come to our communities and the stigma. How do we handle it? Because by defect or by default, women tend, for numerous reasons, so I don't want to disturb the family. Like you did say, one woman is down with cancer, is entirely let's be silent about it. How are you handling this, and how or to help out? Dr. Amina?
Thank you very much. So, really, there is this culture of silence that modesty does not translate to silence, when especially when there is to say anything that is worrying them. They just want to keep quiet because they probably have, and then you have these women not being able to speak out, tell them what is wrong with them. So you need ab initio, a sort of a family that allows openness within, speak out and talk to people about what is wrong with into the community and see these people. Usually they would not speak, go out and spread their issues. And those are the things that actually, make people to this, gossips around the community and all of that. So if we healthcare workers are able to speak to the healthcare workers, again, we encourage women to speak, sisters, so that they would seek, they'll be able to encourage to seek, come up and say, okay, there's something wrong with me, and all of that. It's only when you're able to speak here. What we do again in the community is that, of course, like I said earlier, feel free, they're happier when they see women talk to them. So we have a nurse, when you talk about their felt needs, they are pushed to open up and they tell you what them up, and then link them to care if they have any issues.
I'm going to take a break now, but I'm going to throw the question out and to both some time to think about it. How can, what role the hospitals and the colleagues at work, what role do they have to play on it? The Tabi also mentioned, so it is real. We can't shy away from it. So how can and face the issue and hopefully be among the positive stuff after this break. We'll go on a quick break. When we come back, we'll open the phone lines and take reflections from the audience. Stay with us.
Thanks to crazy motive for what is and what was done. Oh, you who believe, please give thanks to Allahu Rahim. Allahu yuhibbul wa raziquna wa huwa ala ghafur. Allah is Rahim. Allah is our creator. He is our sustainer.
You're welcome back. If you're just joining us, it is Everyday Muslim, and we are on the issues around women and cancer and the families, the entire community, and we don't want it to be that, and that's why we're talking about it here on 917 917. I'll start again, 07055 917 917. Before I will read a message, and I'm going to read it out, but number to text or WhatsApp 708155917 Good morning, Thomas. The doctor only talks about those that are still menstruating, not about menopausal women. So, kids, you need to chip into any of this. Question 2 is breast to breast cancer. Question 3, what is the work of social worker? Government should do more in our health sector, infrastructural development, issues can as well die. May God help us. Happy Independence, Nigeria. Nigeria will rise against us. I'll come to you first, Dr. Habib. So for
Yes, it's not only for menstruating women. For post menstruating till the 6th decade, the incident is still on the rise. And before that's about 40 needs to do this.
Okay. Also exposed to breast cancer.
Oh, well, unfortunately, 90 out of it's only 1% that is a man, and the human breast need to do most of the time breast self-examination. You will see it easily. If you are a man, it's low. Secondly, if the person has it, you will easily see the lump. Size breast self-examination for women.
The question government Lagos University Hospital, and you're the one, you're the head of the cancer unit. How do you need to aside from the grassroots level? How much impact is the government having? So the
last regime and this one, they've been trying to increase there's a lot of development when it comes to oncology in Nigeria. Several Cancer Center is the biggest cancer center in West Africa, 2019, by the former head of, by former president. Also, this cancer center is also has the high, and we have seen up to 13,000 patients. Within that, the facility are always working. We have 4 treatment machines. That's the highest working. The breakdown period is very low. Also, that was last month. I think that should be in Benin, Enugu, and we are having serious training, manpower, build up, surgeons of cancer. However, it's still not enough. The payment for cancer treatment, there should be an insurance because the mere fact that cancer patients are paying out of pocket is a major barrier to treatment.
It's early detection is a major barrier because the knowledge of the cost implication alone is enough to wear and burden 2 questions for you from the pool of questions. Is the work of social workers in hospitals, what is the hospitals, and also government, how much impact do you feel the government at grassroots level?
Yeah, thank you. Social workers are usually within the hospital. We have social workers that are in the hospitals that are geared towards terminals of patients, because health is not just about medical and physical, it's the health of patients. So you have them in the hospitals to help pay bills when they're not able to pay. Sometimes they take care of these patients and make sure that the patients that are brought into the hospitals that do not have any form of support or care are able to do everything, because of course, I mean, the human resource area is slow, much. Also, they also help to gather money from payments to specific patients. But sometimes you know that the need would to be for it to be used for. So that's what the social media are mostly overwhelmed, because it's not just breast cancer they ask to come and pick up. There's somebody that is a child found on the railway, and but the funding is not enough, and the staffing is actually create awareness and increase people's attitude earlier. Every local government has the primary health care awareness within the community. So as many times as possible that they're able to look at this months, like October is a world, the conscientizations around cancers and all of that. So we usually would go out and I'm sorry, do clinical breast examination and teach women on so within facilities what we call the quality improvement team, which else things. So they usually are like liaison officers. So if there's any situation in the community, they actually are those ones that bring this and increase access to health care as it were sensitizations as often as possible. And I'm sure that sensitization and all of that is actually going on within our communities, becoming more and more aware. Thank you very much.
Thank you so much, Dr. I'm now staying with you still. This lifestyle is what we're going to share quick lifestyle tips, actually for people. How we start to do that can, redress how we are more. So you could be the first person that is bringing cancer to your lineage. So how to address it from the grassroots? You are the grassroots person here. Dr. Habib, you go first.
That helps in not just cancer, but hypertension, diabetes, and all that white collar jobs. So regular exercise will help to deter. Alcohol has been implicated, so we can do without. Also, for women who are giving birth, they need to breast cancer, and it also makes the child very healthy, give the child immunity. We should try and see if you can, if you are above the age 25, elderly, older age are more prone to have, breast cancer. The hormones that comes out when someone is pregnant, breast cancer, and there are some other things we need to also, cause, apart from trying to deter breast cancer, having a knowledge of very significant, because we cannot necessarily calculate if it comes earlier. And if we also come from a